Now, still on the commemoration of World Diabetes Day, health practitioners under the auspices of West African Postgraduate College of Pharmacists have advised and called to subsidize the cost of food to enable people living with diabetes afford it for better living. The zonal coordinator of pharmacists, Abubakar Danraka, made the call during sensitization and awareness program in Abuja. Benedict Uko has more.
November 14 of every year is dedicated to create awareness for diabetes around the world. In creating more awareness this year, pharmacists have advised and called to subsidize the cost of food to enable people living with diabetes afford it for better living. At the sensitization and awareness program in Abuja, the zonal coordinator West African Postgraduate College, Abubakar Danraka, called on the government to organize free screening and management in terms of medication for the masses.
This is a clarion call to government to promote free screening and, as much as possible, management of diabetes. It might interest the public to know that the prevalence of diabetics in Nigeria is 3.6% in 20 years 20 to 79. That is, in the age population of people that are between 20 years to 79, you have 3.6% of them that are diabetic, which in the Nigerian population, it translates to about 2 in 10, thereabout, which is huge. Out of every 10 people, 2 are about diabetic, which is huge, very huge. So if government can put subsidy, can put programs that will take care of free screening and free management in terms of medication, it will go a long way in managing the diabetic concern.
Also speaking, one of the fellows and a consultant in clinical pharmacy, Ruth Ajayi, urged Nigerians to cultivate a healthy lifestyle.
Being a diabetic, as I said, is not the end of the world. It's just to modify the kind of food you eat. The quantity plays another important role, because you might not be eating you might not be eating food. You have to reduce the quantity of food you eat. Then you now add vegetables and fruits to augment that.
We need to sensitize people to be very conscious about their health, especially high blood sugar level that causes diabetics. A lot of people, they're not very conscious about their health, and this program help them. Advice, exercise, lifestyle, but the common things for the common man is that we take a lot of unhealthy food. Take, for example, a lot of drinks that is packed full of sugar, and the body cannot handle it. It becomes excess in the body. Some of us, we don't even walk. Ideally, you should take nothing less than 30 minutes brisk walking. When we talk about brisk walking, as if you're marching like a soldier.
This year focuses on the need to reduce the cost of diabetic medications to prevent deaths. Others spoke about the need to take diet seriously.
If we have to go clinical, you talk about genetic factor, because it has been proven that this is inheritable from the parents. The insufficient knowledge or awareness has been found to be a very contributory factor. Our habits, social habits, when you talk about social habits, what kind of life do we live? What do we eat? Where do we stay? Environmental factor. All these are, part of the factors that can predispose or that can, cause diabetes.
The sensitization and awareness is to cut down needless deaths and also for affordability to also reach out to various communities in the FCT.